Thank you so much for having me and for that warm welcome. I'm really excited to be here. There's a lot of friends and colleagues in the audience, and hopefully new colleagues as well. And I have a special place in my heart for all things New York as a New Yorker myself, who has happened to find herself living in Boston for the last 15 years. But my first residency interview was actually at Mount Sinai. And I have very fond memories of that. And a fun little known fact is that I am from the town of Mount Sinai, and I went to Mount Sinai Elementary School, middle school, and high school. And so I decided I needed to go to something named something different for medical school and for residency. So I branched out at that point. So today I am here, thanks to Dr. Karani's invitation to talk to you about the coaching work that we've been doing and what we've learned about coaching across the continuum of medical education, from learners all the way to faculty, and then thinking a bit about how you all can put this into practice and what you can walk away with from what we have learned. Before I continue, I would be remiss not to acknowledge the work of the Institute of Coaching, who helped us design our original coaching program over a decade ago, and also several foundations who have given us grants to study our work and to be able to sit here today and share this with you all, including the Macy Foundation, the Arthur Vining Davis Foundation, and the Physicians Foundation. So we'll talk today about what coaching is and how coaching can work in supporting learners in addition to the other work that we do, and differentiate it a little bit from the other terms we know, such as mentoring, advising, sponsorship, teaching in general, and think about how it works in practice, what we know about the impact of coaching in a learner's experience or a medical professional's experience. And then think about how we can use that. And in particular, what is most helpful, or what are some helpful ways to use that today. And before I dive in, I'm happy to share my slides. I've included references wherever I reference a particular article, and for photo references. But if anybody has any questions about the slides or anything else, I'm always happy to answer those. And Dr. Karani can share my email address with everyone. I'm happy to take any questions if they don't come up today. So one really important place to start for this coaching talk, and every coaching talk that I give, is to make sure that we're actually speaking the same language. Because as you might imagine, there's a lot of different kinds of coaching out there. It's become actually a very popular term, and it's used in a lot of different ways. The kind of coaching that I am referencing today, when you think about that, I want you to picture this image of a stagecoach. And this stagecoach is a vehicle. And this vehicle takes somebody on a journey. And that's what we ask our coaches to do. And that's the type of coaching work that I do, where the coach is the vehicle for a journey from where someone is as defined by them to where they want to be as defined by them. And so the coach isn't the driver, isn't the navigator, isn't there to let them know that the journey is going to be okay, but really is creating a space. And that space is for that journey to occur. And it's a really creative space, a really thought-provoking space, a safe space. And the hope is that as one goes on that journey from where they are to where they want to be, that they do so not in a way to just solve problems, but really think about how can they be the best version of themselves, and how can they bring that to all their experiences in the future. And with that, help really think about what is that best self, and how can you maximize your potential and bring that with you to every part along the way, and believe in yourself and what you are capable of as part of that journey. And so all things belong in this vehicle in terms of their personal space, professional space, but it's only what someone wants to bring with them. And so there's nothing that a coach really pulls. It's really about welcoming anything into that space and figuring out what that means for the journey. And the most important thing, I think, is it's really not about fixing people or their problems, but again, really about helping them be the best version of themselves. So keeping this in mind, this definition in mind as we go along, and I'll differentiate this from other types of coaching you may have heard about a little bit later. But the idea of how one coaches, the most important thing to start off with, and I tell the coaches that I train all the time that really the most important skill as a coach is how you listen. because how you listen will determine what you really hear and what you understand about that person that you're working with. Because the idea as a coach is to listen in a way that you truly understand that person and their journey in a real empathic way of listening, and you reflect that back. But really the idea is that they're the ones doing the talking. They're the ones finding their way forward. And it's you that through your reflections based on how you listen that can help them understand that. And then when they get to a place where they've figured out, a place where they want to grow or thinking about what's next for them, that's really where the questions come in. But it's really questions that are for them as opposed to questions for you, meaning that there's no clarifying questions. It's a lot of times I'm coaching in the dark where I don't even know what we're talking about. But the important thing is that it doesn't matter because the person I'm coaching does. And so I really try to think about what are the questions I can ask that will help them find their way forward, as opposed to help me learn more about it. And so I put this out there not to expect that anyone can understand exactly how to coach in one slide, but to kind of give you this framework of thinking about how a coach approach might look. And then we'll revisit this with some more skills and a little bit of deeper discussion towards the end. So the way that this type of coaching, this definition of coaching and these skills can work to support learners is in a few particular ways. One really important thing is that I can't change the fact that stressors are going to happen to a learner in their journey or a faculty member or anyone along the way. Stressors are inevitable and we will respond to them because we are alive and human and in environments where we're asked to respond to stressors. But struggle within that stressor, within those environments, is actually optional. And coaching, one of the most important things that it can do is it can decrease the struggle that one experiences. When we decrease the struggle, we can change the response. And the way that coaching helps this happen, the way that coaching facilitates this happening, is by first in that space that's created, they're processing their thoughts, their experiences, and the challenges as they see them. And then what you try to do is help them focus on what is most important about that experience, about that challenge, about what's going on for them right now. And really focusing on what's important, where their motivations are intrinsically as opposed to extrinsically, connecting them with what's working for them and what their strengths are, building confidence that they can handle this stressor, thinking about drawing from stressors they might have handled in the past and how they can use that actually to support them, and then considering what other supports are available to them. And so these are all different ways that the coaching approach helps people change their response to stressors to struggle less. The positive psychology part of coaching, which is an important part of the coaching approach that we have used and that many other coaching styles use, is this idea that most of us as humans, and particularly as clinicians, our job is to focus on what's not working in a situation. Our job is to diagnose problems and fix them. But if that is the only lens with which we view the world, then we will be missing a large opportunity to see what resources exist, to see what our strengths are, to see what works about us, to see what makes us happy and thrive. And so much about positive psychology is changing that focus, not so that you're ignoring the negatives, but that you allow the negatives to stick to you a little bit more like Velcro rather than sliding off of us like Teflon. I gave a talk to a room full of surgeons, and I said to them, how many of you know what you're doing wrong? And they all raised their hand, every single, right away. Didn't even think about it. I barely got the question out of my mouth. And then I asked them, how many of you know what you're doing right? And about 5 of them raised their hands very cautiously, like they didn't really want to admit it in front of their peers. So, and if you think about the feedback sandwich that we're used to, I'm going to tell you what you're doing well, just so I can have the chance to tell you what you're not. And then I'm going to coat it with a little bit of positive to make you feel better and walk away. Coaching changes that dynamic completely to say, let's think about you at your best. Now let's think about how to apply that to this. Let's think about what's going well. Let's think about the things that you're doing that are working. And rather than eliminating negatives and weaknesses to move forward, we actually think about what's working and then focus on our strengths as a way to move forward. And that we can actually focus our future achievement based on our past success. Actually think about who are they at their strongest, and what did they do well? What's gotten them this far? And how can they use that to tap into self-efficacy, or the belief that they can do something because they've done it before? And so many times our learners along the way don't feel like they can do anything because they might not have done it before. But they might not have done that exact thing we're asking them to do, but they've done other hard things before. They've conquered other challenges before. And so tapping into that to think about how to help them move forward and be that best version of themselves is one way that coaching can really change that dynamic. So last time I was on service, I had an intern who was disorganized and a scattered mess in the morning. It was a really hard night for her, to the point where she was giving a presentation and we just said, you know what, let's just go talk to the patient. Like, let's just call it. You had a tough night. Let's all go meet the patient. We'll hear the story from them. And afterwards, I knew she felt terrible. And I pulled her aside and I was like, talk to me about last night. She's like, you all hate me. I'm terrible. I'm going to get fired. Like this, I'm a bad intern. And I was like, let's stop and think about what it is that was hard for you last night. And she was like, I couldn't keep track of anything. Like there was so much coming at me. There were so many patients, there were so many pages, and I didn't know what to do. And I was like, I'd be willing to bet that there's been other times in your life where you've had a lot to manage in a short amount of time and have had a lot to keep straight. And she talked about how in college she was like working 2 jobs and studying for the MCAT and doing this other thing. And I was like, what worked then? Because that obviously worked. You're here. And she talked about what strategies she used to stay organized and to make sure she was on track of everything. And I was like, all right, how could that work on your next call? Let's think about how that could work. And so she came up with a few strategies of how she could keep track of her pages and how she could keep track of what she needed to do for her admissions. And the next call night not only went better, but you could tell she felt better because she was trying something. She was working on it. She was working towards something. And so it was a very collaborative discussion where it wasn't about like, let me tell you, last night didn't go well. She knew, I knew. And so we were able to think about when were things hard before? How did she manage it? And how can we use that now? Now, a lot of this also with coaching is thinking about helping people envision the goal. So many times when we're working on things with learners, perhaps we think about like they have a project or they have a learning goal that they've set aside, and we often just jump right into how they're going to make it happen. But what coaching tries to do is stop and think about what actually is the goal? Like, what would it look like if this were happening? What would it look like if you are achieving this goal? What supports you achieving this goal so that you really, a goal actually becomes a vision of who they want to be, as if they've solved it, as if they were successful. Then you can think about, all right, where are we now? All right, what are our options to move forward? And then based on that, what do you want to do? So remember, the definition of coaching had to go from where you are to where you want to be. And so first, what we do is we start off with, where do you want to be? What do you want that to look like? Now let's think about where we are and then what that journey can look like together. The other thing that coaching can do that's really helpful, or the role that it can play, particularly for learners who are often navigating some of these challenges for the first time, is just really understanding what drains and fills your tank. What are the ways you can use your energy that will serve you, and the ways that you use your energy that drains you. And understanding that this needs to be like a filling process that actively occurs, because we do all know that the draining definitely actively occurs for all of us. And so really thinking about both what are the inputs, what are the drains, what is your role in that and the amount of energy you give to those things, and how can you best use your energy in ways that support you. But also how to know what you need so you can ask for it, you can advocate for it, you can look for it and work towards it, align your motivations and your efforts towards achieving that. And there's a study that was published at the University of Washington, which I think was a really helpful study to actually delineate the ways that it wasn't a study about coaching, but it really, for me, lays out why coaching can be helpful. And in this study, what they did is they asked all their medical residents, have you ever been burned out before? Yes or no? Anyone who answered yes then was asked to fill out a Maslach burnout inventory. And anyone who was not burned out on the Maslach inventory, but had said that they had been burned out before, were then interviewed to say, how did you recover from your burnout? And what they recognized was that there was two kinds of burnout that their trainees were experiencing. There was a circumstantial burnout, like I'm tired, I need a few days off, I only have condiments in my fridge, my laundry's piled up, I haven't seen my family in weeks. And those people need those things alleviated. They need time, they need space, they need connections restored, they need food in their fridge. But there's also the existential burnout, which is this idea that do I have meaning in my work? Do I have value? Do I have purpose? Am I making connections with people where I can see this future for myself here? Am I building skills? Am I finding role models? Is this all going somewhere? I think what's important about this is both kinds of burnout require knowing what it is that you are feeling and what it is that you need. And once you are able to do that, you can then learn how to ask for it, how to advocate towards that, how to work towards it feeling better. And that's creating the space for that conversation, creating the space for that reflection is one way in particular that coaching can be incredibly helpful. Now, some of you may be thinking like, well, I do this. I mentor people all the time. Like I'm an advisor, or I work in the school and I have a bunch of people that I supervise. A lot of people will connect with some of this, and you should, because a lot of these skills overlap with each other. The difference is the technique. The difference is what brought you both to the table to begin with. And then the difference also is in terms of the outcome and the process. And this phrase I love is that a coach has some great questions for your answers, while a mentor has some great answers for your questions. And so that coach is really, the goal is to listen and to ask questions based on what you are hearing, based on what's really at the root of what people are thinking about. Whereas that mentor may be more the guide, maybe more the driver or the navigator, or maybe more helping fix problems and provide answers, provide reassurance that it's going to be okay. And and I actually love this table that was published actually just last year in Medical Education Online, where they deviate between not only the different roles, but then also the different types of coaching that exists. Because there's a lot of clinical coaching that happens in healthcare. There's a lot of academic coaching, and all of these things rightly call themselves coaching for one reason or another. But this area all the way to the right, this professional coaching, is really the area that we're focusing on. But what I would like to say is that when done so within a training environment, you can include the other areas, but just having a very particular role for the coach allows there to be shared expectations on both parts. And so this idea that the coachee is directing the conversation and that their coach is really helping by the way that they ask questions that helps the learner clarify what they're looking for. It's not that usual, somebody described it to me as that residents often or students of all sorts sort of look at faculty like an advice ATM. Like I plug in what I need and you spit out advice to me. And that a coach is not going to spit out anything at you. A coach is really going to be there to receive and to learn and to understand, and then to reflect that back and help you explore. And so it's less active perhaps than advising, mentoring, or sponsorship. You're really there for the journey. And I think one way to think about it is that the work is beyond that conversation, is really on them, on the coachee. You can help as a coach with accountability. And the work in the conversation is not to get somewhere, but it's really to explore with them, connect them with their strengths and their self-efficacy, reflect to like peel the layers off and understand what's going on behind there, to tap into those growth edges. That it's really not about what I know or what I've done. And so many times trainees will be like, well, tell me what it was like for you, or doesn't this happen to everybody? And I'm like, what matters is what's happening to you. And I'll often teach our coaches that there's no advice that they can give that will be more powerful than the advice they can help their coachees find for themselves. Because that advice is authentic. That advice is truly personalized to their journey. And so it's really about helping them learn from their lived experience and think about how they can use that moving into the future. So how this works in our approach in the MGH coaching model is that all of our residents receive a coach when they come into intern year. And historically, before this program started, we had mentorship, we had advisors, we had firm chiefs, we had preceptors, we had core teaching faculty, we had all the things that you would think would be enough to support a resident along their way. But what we found was that it wasn't personalized. It was just this like conveyor belt of residency, where at the end they left and at no point was someone like, but how are you doing? How's this whole thing going for you? And I remember as a resident setting goals and knowing that no one was ever really going to ask me how they went. And I constantly walked around being like, how am I doing? Am I like doing how I'm supposed to be doing? And no one could tell me. And the idea is with coaching, you really personalize that. You set goals and someone holds you accountable to them and helps you hold yourself, but then also helps you really understand how you're doing in a way that's truly meaningful to you, so that you can carry that with you beyond your training experience and use that with you for the remainder of your career. And so we recruit our coaches from our teaching faculty, and anyone can be a coach. And we pair our residents and fellows one-on-one with a faculty coach. And that faculty member is mismatched to their career interests, such that me as a primary care physician, I only coach people outside of the Department of Medicine or people who are bound for a subspecialty. So that at no point am I the supervisor, am I the letter writer, am I someone they're going to see at a job interview later on? All I am is a safe space for them. And some people say like, oh, but isn't it important to know what they're going through? It's actually not, because remember, it's about their lived experience. And the less I know about what their day-to-day is like, or what their future fellowship plans or anything else look like, the less I'm prone to mentor, the less I'm prone to give them advice, because my journey wasn't that. And so it both protects the trainee and creates a safe space for them, but it also takes the coach out of mentor role and advisor role and allows them to just exist as the coach. Our coaches go through 3 hours of training a year. An hour of that is on video, and 2 hours is a video that they watch. And then 2 hours of that is currently Zoom, which actually works quite well for this. In the old days, it was in person. And in those trainings, they practice the skills and the exercises that they'll be using with their coachees. They practice them on each other, so they get to practice coaching, but then they also receive coaching. So it's also a really wonderful way to connect faculty with each other. And some people are like, you should just do these trainings a couple of times a year so we can all like see each other. And now that we have 8 departments throughout the hospital involved, like at any given training, you could be connecting with surgeons, dermatologists, your own colleagues. So it's a really fun way to get to know a lot of people. Currently, I do all the trainings at MGH. When I consult with other hospitals and help them start coaching programs, I usually work with a faculty member who will then kind of train the trainer, and they'll take it over from there. But it's typically an internal person who does the trainings. And then the coaches meet quarterly with their coachees, and they have guides that help them with those meetings that kind of walk them through the language that they need. And I say the conversations are protected like HIPAA, not technically. There is no protection there, but it's easy language for us to understand, such that if provided that there's no concerns for safety for them or anyone else, the conversations stay between them. There's no reporting back to the program. There's no documentation. And what we do is we have a one pager of all the things that might come up that would worry a coach, that they might hear from their coachee, and what to do about it, so that our coachees feel comfortable. If they do get into some territory that feels a little unsure what to do with that, they have the supports that they need for it. And so initially, the way that the meetings go, there's 5 steps to every meeting. The first step of the meeting is a quick pulse check of just like, how are you doing? Like, how are things going? How am I finding you today? And also, what's on your mind? What would be useful for us to talk about? Then what we do with every meeting is have them share a good story. And there's actually really great data for this from the positive psychology literature, that starting out a meeting with a good story will help create more mental flexibility, more creativity, and more open-mindedness. So it's a really great way to set the tone for the meeting, but it also, no matter how somebody's day was, it's a nice reset as well. And then each meeting is linked with an exercise, and I'll show you how that curriculum marches through 3 years in the next slide. And then at the end of each meeting, after you've had that chance, what you do is you imagine a perfect year, a 10 out of 10 year, and what that would look like. Because remember, we want to go from where they are to where they want to be. So we create a vision of where would they want to be if this year went as well as it possibly could. And then with that in mind, what do you want to accomplish between now and the next time I see you? So this way they can move towards that throughout the year. They can revise their goals as they're meeting them. They can consider how things are going for them. And it's a really productive space so that hopefully no longer they're saying, am I doing how I'm supposed to be doing? They can actually benchmark and say, this is how I wanted to be doing. How do I think I'm doing? And so rather than this dwell time model where everyone just kind of like progressed through the 3 years with the MGH stamp on their back, what we now have is this growth mindset where everybody has room for improvement. Every year is an opportunity to grow. And each year we start with that vision of what success looks like, and we end with reflecting back on how they went that year. In the beginning, we do a lot about how they cope with stress, what their response to stressors are, and start to really understand what resilience looks like for them. And a lot of discussion about strengths so that we can start to lay the groundwork to help them work through imposter phenomenon and other challenges that they might experience as an intern. In the second year, talking a lot about how do they handle uncertainty? How do they persevere despite stress? Understanding that we want to build ways that it's not taking away from them and they're not giving too much of themselves, but also recognizing, the journey that they are on and starting to think about leadership and emotional intelligence. And in the third year, building skills such as hardiness and helping them understand as each year, as they're evolving, how is that changing their view of resilience and what that means for them? And then thinking a lot in that third year of like how to package this all up. Like now that they're leaving, how do we understand their journey? How do they take this with them? And how do they start working towards holding on to these skills later in life? Now, a lot of times people are like, okay, what does this actually mean in terms of time and effort? And so basically to run this program, now it's like a behemoth. There's fellows, there's residents, there's 8 different departments. But what we've done is pretty much make it the same program, no matter the same curriculum that we change each year. So no matter whether you're coaching a surgeon or a dermatologist or an OBGYN resident, you are still using the same approach. And basically you have trainings that they go to each year, 2 hours of training, and then the video training in advance, this is an older slide, so that's not on, this is a pre-COVID slide. And then you have the time that you're meeting your coachee. And usually you meet first just to like kind of get to know each other, so you're not just like diving right into it. You meet with your coachee quarterly. And you have like the time that you would like prep to really like get your head in the game for the meeting and thinking about time to reply to emails. So we tried to think of everything that we would be asking of these people. And it's about 9 to 10 hours a year per coachee. And each faculty member typically has 2 coachees. And then for the coachees, they're meeting 4 times a year, and then similarly emails and stuff. So for coachees, we're expecting about 5.5 hours per year. And then our recommendation, if you're going to emulate this program, is that you have a coaching program director. And that commitment is about like a 0.1 FTE per year and is best served with some administrative support. And so the funding for this program comes from our residency program. They pay for part of my time to run this program at that FTE. And our coaches are not paid. Our coaches volunteer their time. And they get CME and MOC. They get 20 MOC credits per year for participation as part of like the fast track quality improvement process. So all they need to do is send our program director their name and their ABIM number, and they get 20 MOC credits a year, which is pretty incredible. We try to give them perks wherever we can. We help them with where to put it in their CV so that they get as much credit as possible. And then they get the coaching skills. And there's some cool data that I don't have here because we haven't finalized it yet, but telling us about all the different places that coaches are using these skills. And it's actually pretty remarkable with patients, with their families, with other learners, with each other, with their bosses. So these skills are very transferable. So speaking of data, thinking about what we have learned at MGH and then what others have learned in the coaching world. And this is a very brief deep dive into, or not deep dive, this is a very brief foray into what's out there. And what I tried to do is cover all the kinds of learners that you all might be thinking about, knowing that not everybody's working with residents, not everybody's working with physicians, and really thinking about what do we know as far as what's out there in the literature. And I will say there's not a ton. So if this is something anyone's interested in, get out there and publish it, particularly if it's not about residents. That's where it seems to be the most data. So in undergraduate medical education, the interesting thing is there's a lot about clinical coaching and academic coaching. Like, I'm going to help you with your competencies, and I'm going to help you with your EPAs, and we're going to track them, and you're going to meet with me. And it's very like hand in hand, where both people are really giving a lot to that relationship. The only kind of coaching in the type that we are talking about was the study that I found where they randomized learners to either working with a faculty member who was given a brief coaching skills training, which sounded, when I looked through the methods, like pretty similar to what we do in that first hour of our coaching training, that helped them think about how they could ask questions and use a coach approach to helping them set learning goals, and then think about the actions that they would need to take to achieve those goals. And learners who were randomized to working with faculty trained in these coaching skills had better learning goal development and a higher likelihood of learning goal implementation and achievement. And so really thinking about when you put people together with some basic coaching skills, achieving goals is one definite outcome, setting goals and achieving them. And that's actually, I'll show you what we found in our original first year study as well. So in my mind, what this does is it's creating a space and giving that faculty member those skills. Then that is very reproducible in different environments where there are goals. Then thinking about faculty. So there's two major studies that people may have heard about. One was at Harvard Vanguard, and one was at the Mayo. And basically in both, they took clinicians. Harvard Vanguard was PCPs, and in Mayo, it was physicians in general throughout the organization. And they both were randomized to either coaching versus control. The coaches were from outside the organization, hired specifically for this purpose. And in each one, they were coached for 6 sessions over either 3 months or 6 months. This 6 sessions number comes up in almost every coaching study. If I were to do, like, if I did my druthers and all I did was study coaching all day long, I would do like 4 versus 8 versus 6, because we don't even know, but 6 is the number that's out there. And what they found in the HVMA study is that coaching significantly decreased burnout and increased engagement and psychological capital, but specifically not in the form of self-efficacy from pre to post. And that there was no change in job satisfaction, job stress, the likelihood to leave or reduce your clinical time, no change in compassion or self-efficacy, which was interesting to me. And those changes were sustained though at 6 months. The Mayo study doesn't report on whether their changes were sustained, but what they did find was decreased emotional exhaustion. And in fact, that the control group emotional exhaustion increased. There was decreased burnout. And that was all really driven by emotional exhaustion, because depersonalization did not change. Improved quality of life and improved resilience compared to the control group. But similarly, no change in job satisfaction. This study did not find change in engagement or meaning in work. And so future studies definitely are targeting on those areas, but finding that coaching does move the needle, probably primarily in terms of burnout and perhaps some resilience factors. The HVMA study didn't look at resilience specifically, so I'm wondering if some of these components might be capturing similar things in terms of resilience. And then looking at nursing and the care team, there was a lot that was descriptive about nurse coaching in the literature, but nothing with outcomes. And so the ones that I could find, the one thing that I did find though was that, and I know this format has been used elsewhere, but there was a study that was done where they embedded a coach into a neurosurgery team. And this coach observed them over a course of a couple of weeks on rounds and in team meetings, and then gave feedback to each member, feedback to the different role groups, and then feedback to leadership. And based on that feedback and those interactions, this led to improved communication and the nursing MD relationships within the team. So there's other data that exists in the APP and nursing literature, but as I mentioned, the outcomes are limited and they're much more descriptive about just what's being done or what the role of coaching could be. So my hope is that in the coming years, there'll be more of this that is available. Thinking about what we have learned at Mass General is we have had thousands now coaching meetings over the last decade. And so the biggest challenge that I had when starting this program is people are like, nobody's ever going to meet. They're never going to do it. You're not going to get these people to do it. And I was like, I might not be able to get a second or third year resident to do it, but I bet if I catch an intern before they even know what internship is, I can get them to do it. So we started simple. We started with each intern year over the course of 3 years, and we rolled it out, and then we just kept them coaching in their relationships to the point where after 3 years, then everybody had a coach. And then what we found, and certain programs, residencies within our hospital who aren't totally sure that all their trainees want it, they go with an opt-in approach. So you don't have to do all in. There's all different ways that you can do this based on your learners and what you think would best support them. And what we found is that more than half of our trainees were meeting 3 or more times a year with their coach, and the bulk that weren't meeting that 3 times were usually about 2 times per year. And in year 1, we saw a 3 times increase in self-reported goal setting, similar to that first study that I showed you in medical students, and also decreased emotional exhaustion, so similar to that Mayo study. And what we have found is that we have hundreds of faculty members now across these 8 departments who are engaged in coaching residents and fellows. And when we compare our burnout and well-being data to our coaches compared to non-coach faculty, and there's confounders there, and there's, you know, who shows up for coaching versus who doesn't. But we have increased burnout and well-being, improved burnout and well-being, and increased workplace satisfaction in our coaches compared to the baseline non-coach faculty within our physicians organization. Coaches primarily describe this as a very meaningful connection to trainees in a really large learning environment. It's one relationship that they can develop very fully and have the time to do that. And the drumbeat of, I wish I had a coach, or we should really do this for faculty, kept coming up to the point where we now have a faculty coaching program, and which I'll tell you about. And that, as I mentioned earlier, over 85% of our coaches say that they use their coaching skills with others, patients, colleagues, learners, family, and friends. And our coaches stay. So the ones who are still at the hospital stay as a coach. And that to me is like one of the biggest selling points, is that people don't want to leave these relationships or leave this commitment. And what we found in terms of the learner experience is we tried to see like what's happening in these meetings other than setting goals. And so we asked about different stressors that residents experience. And what we learned in the first few years is that residents described basically what you see here is that the red bar are people who fully participated in the program, and the blue bar is people who partially participated. And then along the y-axis there, you see the different stressors that we offered as potential stressors that residents may experience. And what we found is that the more they participated, the more that they felt that coaching helped them manage the stressors and cope with the stressors that they experienced throughout residency. So that makes sense. You're showing up, you're finding some benefit, and it's helping you cope with stress. And then we also found that the better your relationship with the coach, the better that you're coping with stress in that area is. And so blue bar is an excellent relationship, red bar is a good relationship, and the green bar is a fair or a poor relationship. So showing up makes a difference, and having a good relationship with the coach makes a difference. And so when we saw this data, we doubled down on our communication to make sure people knew about what is coaching and how can it help. And then we doubled down on our training to make sure that the quality of communication with the coach was as good as we could possibly make it. We were still like, what is happening here? Like, what is this whole coaching thing going? And so we did this study where we actually looked at PERMA, which is a well-being tool, a well-being assessment. And then we looked at burnout, and we said, are they correlated? And what you'll see here is that, in fact, they are not. And this really helped to emphasize that we're not just looking at burnout and well-being as 2 ends of a spectrum, and that they're 2 different parts, and that it's really burnout and engagement that are probably at the same spectrum, and our different definitions support that. And that well-being is sort of overlaid on top of that, whereas burnout can certainly take away from well-being, but getting rid of burnout isn't going to then achieve well-being. And I think this is really important for us to see in terms of what can we expect from coaching, what can we expect from any of our efforts in terms of supporting trainee well-being, and that focusing just on getting rid of burnout may not be the answer. And it also helps us put some of these other coaching studies into context. So then we started thinking about like, okay, what would it look like if we did it? What would our goal be, our 10 out of 10? And if our 10 out of 10 was an engaged physician who had a lot of professional fulfillment, came to work in a positive work environment and had very high well-being, how could we measure that? And how could our data show us that? So this was our hypothesis. And then we thought about, okay, well, there's how positive that person may be, how they cope with stress, how they use gratitude, how they tolerate uncertainty, how they set goals. There's how they cope with stress, their self-awareness, how much they reflect, how their purpose in their work. And then there's also all the factors that are part of who we are and the environments that we work in. And then so we looked at how we could measure each of these things as related to these factors. And in this multivariate analysis, what we found was that hardiness, which is one way to measure how you cope with stress, or another, some people use it as a marker of resilience. Coping and self-awareness, or how you reflect, significantly impact the well-being, or PERMA, or happiness is another way to think about that one, of our trainees. And then the factors that affect burnout are different. So hardiness hits in every study, and we're going to be publishing a few studies in this coming year that talk a lot about this hardiness tool. Tolerance of uncertainty, how often they set goals, how often they reflect, the relationships they have, how supportive leadership is, and how meaningful their relationships are throughout their different roles, all seem to have a significant impact on their burnout. And then gratitude was one they kept laughing at me at every research meeting. I'm like, but what about gratitude? It's got to be in there. And in our small studies, we haven't found as much of a mark, but stay tuned, because in some of our larger cohorts, we're able to see a really great signal where gratitude and burnout are really linked. So it's no wonder that these two that burnout and well-being aren't correlated. But what's important to me about this multivariate analysis is helping to think about how can we target the things that impact that engagement, that picture of who we're looking to help create through these efforts that we do for well-being. What are the clinicians that we are looking to build? What are the skills we're looking to build? What are the environments we're looking to really impact that can help them have the best outcome for themselves? And this starts to help us see the different levers that we can actually pull with our interventions, be it coaching or otherwise. So we have all these different studies going. Just coaching work outside of MGH. And that's actually some of the studies I just showed you were multi-site studies, looking at it outside of internal medicine and outside of residency. And so we have some randomized controlled trials that have been really illuminating that we'll be publishing this year. Doing virtual coaching through different professional societies, similarly, really interesting results we should be publishing this year. And then we have a faculty coaching program that we actually invested in certifying our own faculty to become coaches, and they're now working one-on-one with coaches. So what we've done is we've doubled down on that Mayo study and have done it internally to see if we can have those same outcomes. And so what we've learned in all of this, if you're like, well, that's great and all, but we don't have all these programs, so what am I supposed to do with this? The one thing that we've learned is any way that you can create a safe relationship for your learners is key. So if they don't trust it, they're not going to open up. If they don't open up, all your listening, reflecting, and powerful questions are never going to do anything. And that there's something about clicking that has less to do with what you have in common and more to do with that presence that coach brings to the environment. And also a lot to do with the expectations that you're setting for your coachees. And many worried about what about those that don't lack insight? That's not impossible and not a barrier. And we've learned ways to overcome that. And as these coaching initiatives, from whatever degree or intensity that they're implemented, setting the culture is one of the most important things right from the get-go. And that having coaching experience with a champion as opposed to a committee is incredibly helpful, because having this be somebody's drum to beat and somebody's job to make happen makes a big difference. The one coaching program that didn't take off right away that we started was one that never had a champion to start with. So what I suggest to learners is, like, fine if you don't want to meet with your coach, but build relationships that are supportive, that you feel safe sharing. Reflect and set goals with a place where you feel safe, an opportunity where you can really think about what works for you, what feels good, what your strengths are, what resilience means to you, and have a place for accountability. That's really important. And as I mentioned, for you all, if you can invest honestly in the listening, that would change all of your conversations moving forward. But this idea of investing in listening to understand, listening to really know who that person is on the other side, as opposed to listening just to respond or reply. Listening so that you're not trying to do anything with the information. So many times, and I still do this, I assume that if someone's coming to me, I have to do something for them. I have to fix it. And I've learned that if I just help them be in it, that I can do so much more for them. And that's where my reflections really come into play, and thinking about how can I reflect back what they are saying, because so many times it might be the first time that that came out of their mouth. And so how did I help them really understand what's behind their words and peel off those layers, dig deeper, so that we can expose their growth edges and help them figure out their way forward. And so as this all comes together, you'll find someone with a goal or a challenge or something on their mind. And you'll notice here that most of it is reflecting and listening. And that occasionally questions come in. And when we do, our questions that are most helpful are really our what and our how questions that help them explore for themselves. And so I always tell our coaches, if you're going to ask questions and create a different dynamic, start with what and how. Make sure the questions are for them and not questions for you to learn more. And after your questions, reflect. Help them explore what just came out of their mouth. So I realize this is a whirlwind tour of coaching, but one thing I think is really important about today and how this dynamic, this listening, reflecting, and asking powerful questions can be so important to our learners today, is that when we think about faculty, these last 2 years have been hard, obviously, but we have our whole career. When we think about learners, they signed up for something. They signed up for a set amount of time where they were going to achieve particular goals and have an experience based on what they were told it should be like. And that's not what has happened, which means that their expectations and their reality are now mismatched. And that is hard. That breeds resentment. That breeds anger. That breeds frustration. So to break through that and have a different conversation, we need to stop trying to fix it for them. We need to help them see that as the loss that it is, listen to them about their experience, and help them articulate, what has this meant for you? What is the impact? And how do we move forward with all that in mind? We can't take away what has happened, but we can identify that for the gap that it is and think about what are the goals that we could use to actually start to move forward through this time, despite what has happened. So this idea that really promoting growth by building a sense of control that's been taken away from them, a sense of agency. We can't fix what cannot be fixed, but we can help them identify learning goals that overcome the gaps that they've experienced because of how their experience has been changed. So really listening and letting them share freely. This is one of the most important things that these learners need today. So lots of people to thank, and lots of ways that this work has allowed me to work with different people around the country, which I'm very grateful for. My email address is here for anyone who has any questions or wants to learn more about this. And I think we have a few minutes to be able to entertain some questions now.
Thank you so much, Kerri. I'll ask you if you don't mind minimizing your slide so I can see people's hands. That would be awesome.
Yeah, and I'll put my email address in the chat.
All right, Professor Akhtar.